Hello everybody and welcome back to the channel. My name is Mike, just in case you're new here, and I've got CT results. I don't have any images because I didn't get the CD because the radiologist left early, and I think we got done at like 3 o'clock, so it's whatever. But I do have the findings and all this other stuff. I also have, I'm not going to say it's the complete history, but it's a very quick rundown of everything that I've been through since 2015. So I can gladly share that. That way I'll have anybody that's new or somebody that, hasn't seen the my cancer journey story so far video. This will tell you exactly what I've dealt with. The impression so far is interval enlargement of large right soft tissue mass involving the right lower lateral abdominal wall, basically my tumor. A loop of distal ileum adjacent to the mass shows wall thickening and mucosal hyperemia, which I already looked that up. Mucosal hyperemia is an increase in redness in the mucosa or lining of the body's tissues. It can be a normal response to certain conditions, but it can also be a sign of inflammation or other issues. They said that is new. This may be infectious or inflammatory. A 0.3 left lower lobe solid pulmonary nodule, new since 6/24. I don't like that. I don't like that at all. Additional chronic findings as documented in the body of this report. So here starts the rundown of my cancer journey, just a quick going through, and then we will find everything they found. So this quick rundown, if you are curious, sorry about any mispronunciations or any of the stumbling of words. A 32-year-old male with stage 2 transverse colon adenocarcinoma in 2015. Partial resection followed by observation until development of obstruction of June 2017 from recurrent disease. Right hemicolectomy with ileostomy followed by 9 rounds of Folfox completed in December of 2017. He opted for a treatment break and then presented in March of 2019 with symptomatic right abdominal soft tissue mass and right inguinal LED with biopsy confirming metastatic adenocarcinoma. He was initiated on Folfox 4 more rounds outside, followed by transition to LBJ in 2019 with restaging suggestive of treatment response. He was continued on Folfox and experienced oxaliplatin hypersensitivity reaction, tachycardia, anxiety, back pain with 8 rounds subsequently. Transitioned to single agent 5FU November of 2019 through March of 2020 with consistent adherence. Increase in abdominal wall mass and stable right inguinal LN subsequently treated with FOLFIRI from April 2020 to March 2021 with addition of Avastin in September of 2020. He had restaging at MD Anderson in 2021 with ongoing increase at these 2 sites of the disease, with ongoing associated abdominal pain limiting his quality of life and activity due to pain alone. Initiated on irinotecan and cetuximab in 2021 through 2023 and now 2024, with initial response followed by consultative RT in 2022 and then on observation PET scan in 2023. Raised concern for local reoccurrence at the anastomotic site and known large necrotic right abdominal mass. Resumed cetuximab and then hospitalized for bowel obstruction and could not resume until February of 2024. Switched to monthly dosing since late February of 2024 and has better tolerance in terms of energy and appetite. Missed the dose early in July of 2024 after hurricane, and there was a delay in rescheduling. Worsening abdominal pain, measurements on outside imaging, patient rising CEA. He was agreeable to resume every other week dosing. Yeah, that's basically just a quick rundown. This is the findings. Lines, tubes, and hardware. Tip of the right chemotherapy port is within superior Yeah, it's there. Just so you know, they see it. Lower neck divisional. I'm gonna throw something at something. I can't read. Jesus. Lower neck. The visible portions or the lower neck and thyroid are unremarkable. Lungs and pleura. Similar appearance of a 0.3 centimeter left lower lobe solid pulmonary nodule presented in June of 2024. Treated lesion in medial segment of right middle lobe with 0.6 centimeter residual speculation, stable since March of 2024, but significantly improved. Okay, so lymph nodes are good all around there. My heart's good. Liver says a redemonstration of wedge-shaped hypodense observation and lesion in hepatic segment 4A surrounding the falciform ligament measuring 2.6 by 1.2 centimeters, which is grossly stable dating back to 2022. So it's just fatty infiltration on my liver, but my liver's fine. Like, it's okay. There's a little bit of fattiness, but no, like, new lesions. Pancreas, spleen, and adrenals are all normal. Gallbladder, there's a gallstone identified, but there's no inflammation. That's good. Kidneys, equal enhancement, bilateral, no hydronephrosis or fracture. Similar size and appearance of the right, 0.4 centimeter, non-obstructing interpolar renal kidney stone. I don't know why they have to say all these giant words and bull crap. Just, dude's got a kidney stone. 0.4 centimeter kidney stone in his kidney where the stone is. The kidney stone. Lower esophagus fine, stomach's good. Small bowel, left lower quadrant ileostomy, loop of distal ileum adjacent to soft tissue mass shows wall thickening with the hyperemia, which is new. No obstruction, colon. Post-surgical changes from right hemicolectomy and transverse colon without evidence of local disease reoccurrence. Right lower quadrant loop, colostomy, appendix not seen. That's fun. No appendix. And finally, what we all came for, soft tissue, redemonstration of soft tissue mass involving abdominal wall, the right lower quadrant measuring approximately 7.4 by 4.9 by 13.6 centimeters. Previously, 8.5 by 4.5 by 13.3. So it was 8.5. Now it's 7.4. It was 4.5. Now it's slightly wider at 4.9. And it was 13.3. Now it's 13.6. So it's kind of shrunk and kind of it's like growing in a different way now. So we got to figure that out. With calcifications and extends superiorly along the transversus abdominis. The mass extends from the peritoneum to the skin surface. Mild generalized subcutaneous edema mostly affecting the abdominal wall, right proximal thigh and hip. So basically there's redness that they're worried about. There's a gallstone that they're not worried about. There's a kidney stone that they're not worried about. Lack of a better term, my tumor's basically the same, and it seems like we're just gonna stick to the schedule that we're on. It is, from what it looked like, it is pushing on the hip, but this is all from my brain. I'm not a certified doctor. I don't have a PhD. I've just been doing this for so long. I've got an idea, but I'll know more on Friday because that's when I'll actually talk to the doctor and she'll be able to tell me like, yeah, no, this and that and blah, blah, blah. So, okay, well, that's not necessarily too much cause for concern. The fact that it hasn't done anything, it hasn't shrank, is a little concerning. Because, I mean, come on. What the hell? I'm doing this every other week. But my theory on that is I've done too much. Like, I'm doing it too much all at one time. So I'm hoping that going to this every 2 week schedule changes it up. And my body actually, like, it can heal and respond to the cancer itself. My own immune system can come back and start fighting. I think that's what happened when I was on a once a month schedule. I would hit it with the chemo, and then my immune system would start coming back, and it would attack the cancer itself. So I think right now my immune system's down, and all I'm doing is hitting it with chemo. So we'll just have to wait and see. But I believe that's all I got for y'all today. We will find out more come Friday. And hopefully I can also get a CD Friday, and then I can show you all the photos and all that good stuff. Hopefully y'all are having a fantastic Wednesday, or whatever day you're deciding to watch this on. And keep an eye out for them silver linings. They're out there. Gotta look for them, though. And until the next video, I'll see ya. Bye-bye.